Awareness Day, overdose deaths are on the rise, but many go unaccounted, hidden by poor data collection and the lack of national tracking strategy. A recent survey found that 84% of respondents had experienced an accidental overdose. Yet the issue remains largely invisible in our public health response. To speak more on this, let's now welcome Technical Advisor for TB HIV Care, Dr. Andrew Scheibe. Doc, thank you so much for your time this afternoon. So, I mean, just going back to that number, the survey findings showing that 84% of the respondents had experienced accidental overdose. I mean, that number seems very high. What does this figure tell us about just the scale and the urgency of the overdose crisis, particularly in this country?
So it definitely lets us know that there are a large number of people who are at risk of overdose and overdose deaths. We look particularly at opioid overdose, so that's heroin, and we know that that's a raising problem in South Africa. And it does just let us know that we have to be aware of improving our prevention efforts, but also to get a better sense of the data. It was from a survey done around service providers, so there are limitations with that data, but it definitely points to a growing public health problem.
And just speaking and staying on the data, why are we struggling, with poor data collection and the absence of, I think they said, the national overdose tracking system? Where do you think the fault lies there?
I think it's generally our data system around drug use is not great. And because there's a lot of stigma and discrimination towards people who use drugs and the health of people who use drugs, it hasn't been prioritized. But we know that people who use drugs have got a very high risk of mortality. So it's partly just not enough political will. Sometimes our people who die from overdoses die in the community setting, so they don't necessarily reach health facilities. So the way in which data from overdose deaths is collected in other countries where there are huge overdose epidemics, it's using community networks, information that comes from hospitals, information from emergency services, and they all get collated into what's called an overdose surveillance system.
Yeah. I mean, overdose is often treated, as we've also just heard, as a criminal or even a moral issue rather than a public health crisis. I mean, what are the consequences of this framing, and how do you think we can shift to a health based approach more than a criminal one?
Excellent question. So, drug use is a health issue, and most people use drugs without major concerns. But when people begin to have dependence, that's when we have public health problems and problems for the individual. And the specific drugs, particularly heroin, which we call locally nyape or wunga or sugars, can have a high risk for overdose. And if people are identified early, they can receive a medication called naloxone, which is an antidote, and it works very well. But often, because of fear of police or of exclusion in society, when people do have an overdose, they're fearful to tell family members, even to call the ambulance or to call the police. And that's a major barrier. And in countries where there's been a shift in understanding that people with drug use problems need help, when help is provided in a welcoming, supportive way, people's lives can be saved. People who use drugs and community members need to be aware of drug overdose. It's an important risk factor of people who use drugs, particularly people who inject drugs. But there are ways that we can save lives, and all overdoses are preventable.
And just talking about, the political will per se, from your perspective, what would a national overdose prevention strategy look like in South Africa? And I mean, who should be at the forefront of that?
So it definitely shouldn't be viewed in isolation. And so South Africa, we have quite a good policy called the National Drug Master Plan, and it's currently in review. But what is really critical is we need to implement the aspects that are evidence based. So while drug use is a major problem, and ideally we want to prevent drug use, it's really difficult to do. And many people use drugs for a range of issues. And harm reduction is an evidence based approach that recognizes that while people are using drugs, we can reduce the public harm. And the World Health Organization has given very clear guidance, and so the National Department of Health really should be at the forefront because they are responsible for health interventions, and naloxone as an overdose intervention is one such. But as I said, while naloxone is available in hospitals, most people actually overdose in the community. So the strategy has to involve the National Department of Health. It needs to include the National Department of Social Development because they are mandated leading the country's response to drug use, but also the Department of Correctional Services, um, education institutions, because in many contexts, people can overdose in all of those situations. So the strategy needs to build into our broader response that uses human rights aligned, evidence informed interventions. And the overdose strategy is just part of one of those responses. Importantly, we have to have more access to opioid agonist therapy, which is the treatment for opioid dependence, because just by people being on that treatment, it halves all chances of death, including from overdose. So that's a really important component of the overdose prevention, not just naloxone awareness, but also opioid agonist therapy and reducing stigma. That's a really important thing. People understanding what drugs are, what the risks are, but also addressing many myths that people have.
Yeah, reducing stigma and also breaking the silence, I think. But thank you so much for your analysis and your time on the program, Doctor. Really do appreciate it. Technical advisor for TB HIV care, Dr. Andrew Scheibe, there for us as today marks World International Overdose Prevention Awareness Day. All right, so let's take you to this now.